It's usually right around my eye, right behind my eye.
Numbness in the face. If it's really bad, I have the thinking is getting difficult.
Very sensitive to light, very sensitive to smell.
It's just a devastating pain.
For more than 10 years, Frauke Huebner had headaches, pain that would start with the humidity of summer and plague her daily.
I had basically 24/7 headaches. I couldn't function anymore. And the worst thing was that I even didn't know what it was.
What she was having were migraines.
The main reason to try to get the right diagnosis is that until you do, you can't get the right treatment. End up with worsening of the headaches or...
Headache expert Dr. Carolyn Bernstein says of the 30 million people in the U.S. who get migraines, half have never been diagnosed, and another 25% have been misdiagnosed.
We use a checklist here in evaluating headache patients and ask people to check off when they come in for the first time. For a lot of patients, when they see things like yawning before a headache, muscle stiffness, irritability, food cravings, they'll look up and they'll say, well, that's me. I have those things, but I never realized that that was part of a migraine. So I think that people feel validated when they realize that they're not alone.
Common symptoms of migraines include pain on one side of the head, sensitivity to light and sound, vision changes, and nausea or vomiting. Some symptoms can last even after the pain goes away.
Extremely exhausted after I've had a headache and taken the medication, so it'll knock me out for 2 days because the headache day and then the following day.
Often, Smokey Eule gets migraines when bad weather moves in. Today, it's snowing, so she's taking her medicine before her headache worsens.
Treatments really do work, and you have to really approach it very methodically, and you have to seek care. Really, seeking care is the key. You can't just hide under the covers.
Treatments include a variety of newer medications specifically for migraine, and other therapies like biofeedback and acupuncture.
Once you have migraines, you're always waiting for the next one that's going to disrupt you at some terrible moment in your life. Once they realize that they can make plans, that they can do activities with their family, that maybe they have an abortive treatment, a treatment to stop a migraine when it gets started that's going to work, they are liberated and they feel like they're in control again.
Taking control also means understanding what triggers your migraines. Keeping a diary of what you ate or did prior to having your headache can help you recognize and avoid behaviors that could cause a migraine. After her diagnosis, Frauke learned a lot about her triggers, not just humidity, but strong odors like perfume. Daily medication is helping to control her migraines, enough so she's able to travel with family and embrace the outdoors.
It's a special thing not to have a headache, and that's the moments that I enjoy life and that I'm very happy, and things are so much easier being without a headache.